Hi, my name is Jada. I am the narrator.
I'm Hannah, the technologist.
I'm Sarah, the patient.
And I'm Kaylin, the videographer.
Today we'll be doing a video demonstration for the esophagus and the stomach. The esophagus has one projection, which is the PA projection in the REO position. The stomach, we have the AP projection, the PA projection, the PA oblique projection in the REO position, and a lateral projection.
Hi, Ms. Pearson.
Hey.
I'm Hannah. I'll be your technologist today. Could you verify your full name for me?
It's Sarah Pearson.
And your date of birth?
July 30th, 91.
Okay, and do you know what you're here for?
Yes, I'm getting an exam on my throat and stomach.
Yes, alright, so what we'll be doing is giving you some liquid to, like a thick chalky liquid to drink, and that'll coat the inside of your esophagus and your stomach, and we'll be having you lay down on the table and move around a little bit so that the radiologist can see everything that they need to, okay?
Okay.
Alright, so I just have a few questions for you. Did your doctor say anything about not eating or drinking after midnight?
Yes.
And have you done that?
Yes.
Okay. Have you chewed any gum or smoked since midnight?
No.
Okay. Any known allergies?
No.
Recent surgeries?
No.
Have you been experiencing any nausea or vomiting?
Nope.
Okay. Alright, well let's go ahead and get started. Is there any chance you're pregnant?
No.
Okay. Go ahead and lay on your stomach. I'm going to put this shield on you.
Hannah will now be demonstrating the esophagus projection, which is a PA projection in the REO position. She will rotate the patient 35 to 40 degrees up on her right side.
Okay, go ahead and turn on your side a little bit so you're facing me, but that you're not all the way turned. Okay, that's perfect. Let me get you to raise this arm up a little bit, but brace yourself with that arm and this knee. Just going to make sure that everything is lined up.
She will be using a 14 by 17 cassette lengthwise with her marker placed on the right side midline, off-center midline. This position allows for a complete filling of the esophagus. The central ray is perpendicular to the IR. She is centering. She will be centering at T5, T6, slightly above the inferior angle of the scapula and 2 inches lateral to MSP. For complete filling of the esophagus, the patient needs to drink continuously while the exposure is being made, so Hannah will instruct the patient to do so.
Okay, let me go ahead and give you this cup. I'm going to turn that like that. Okay, I'm going to go behind this wall and give you some drinking instructions, and you just do that till I tell you to stop, okay?
Okay.
Okay, Ms. Pearson, go ahead and drink. Drink, 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 beep. Okay, you can stop drinking.
Hannah used 100 kVp in a mass of 7. The next projection will be of the stomach, still in a PA oblique projection, REO position.
Okay, let me take that cup from you.
She will rotate the patient even more to 40 to 70 degrees up on her right side.
Okay, let me turn you back just a little bit more. There we go.
This position increases gastric peristalsis. The central ray is perpendicular to the IR at the level of L1 and L2. The centering point is 1 to 2 inches above the lower rib margin at the level of L1 and L2. Halfway between the vertebral column and the left lateral border of the abdomen. She will still be using a 10 by 12 cassette lengthwise. Once again, 1 to 2 inches above the lower rib margin at the level of L1 and L2, and halfway between the vertebral column and the left lateral border of the abdomen. Respiration is suspended at the end of expiration.
Okay, Ms. Pearson, take a deep breath in for me. Blow it all the way out. Hold it out. Beep. You can breathe.
Hannah used that KBP at 100 and a mass of 10. The next projection will be a PA projection.
Okay, go ahead and turn all the way on your stomach.
Hannah will still be using a 10 by 12 cassette lengthwise. The reason for this projection is to visualize the stomach when it drops in the upward position. Central ray is perpendicular to the L1, L2. She is still centered 1 to 2 inches above the lower margin of the rib at level of L1 and L2, and a half inch between the vertebral column and the left lateral border of the abdomen. We are trying to see the pylorus of the stomach. Respiration is suspended at the end of expiration.
Okay, Ms. Pearson, go ahead and take a deep breath in. Blow it all the way out. Hold it out. Beep. You can breathe.
Hannah used a KBP of 100 and a mass of 8. The next projection will be a lateral projection.
Okay, Ms. Pearson, go ahead and turn on your side so you're facing me, please.
She will still be using a 10 by 12 cassette, lengthwise. The central ray is perpendicular to the level of L1, L2. She is centering about 1 to 2 inches above the lower rib margin and a halfway between MCP and the interior margin of the abdomen. Our focusing point is still the pylorus of the stomach. Respiration is suspended at the end of expiration.
Okay, Ms. Pearson, take a deep breath in. Blow it all the way out. Hold it out. Beep. You can breathe.
KBP is 100 at 10 at 20. 110 at 20. The last projection we will do is the AP projection of the stomach.
Okay, Ms. Pearson, go ahead and turn on your back.
Still using a 10 by 12 cassette. Perpendicular to the image receptor at the level of L1, L2. We are halfway between the xiphoid tip and the lower margin of the ribs, and midway between MSP and left lateral border of the abdomen. Our focusing point is the pylorus of the stomach. Respiration is suspended at the end of expiration.
Okay, Ms. Pearson, last one. Take a deep breath in. Blow it all the way out. Hold it out. Beep. You can breathe.
KBP is 100 at 8. And that concludes our video demonstration.